Hello, and welcome to your workflow walkthrough for eMeds in Hospital in the Home and Community Older Persons Intervention and Liaison Outreach Team. Today we will be covering the following outcomes: differences with a HITH and HITH COPILOT discharge in comparison to irregular inpatient discharges, changes that will be occurring to the discharge summary, and processes around discharge summaries. The discharge reconciliation and its functionalities, HITH and HITH COPILOT medications on the MAR, and what happens if a patient is discharged in error inadvertently. eMeds in HITH and HITH COPILOT. HITH and HITH COPILOT services provide admitted level care to patients outside of our brick and mortar hospital facilities. That means that patients remain as virtual inpatients for ongoing care. From June 2nd, 2026, HITH and HITH COPILOT will go live with eMeds. This means that some of your usual eMeds practices may differ for a patient going home with HITH care. Key process changes for hospital staff. There are certain workflows you will need to be aware about for patients being transferred to these services. Some of these key process changes for hospital staff are below. The decision to admit transfer to HITH from ED or the ward. At this point in time, medications for HITH are ordered on EMR eMeds. If antibiotic infusers are required, a two-phase power plan will be available for antibiotic infusers. If the patient is transferred from ED, chart HITH meds and generate the script for any other medications. They are transferred from the ward. Complete a discharge reconciliation. Chart and generate scripts for HITH meds. Prepare to transfer to HITH. For all patients, any non-HITH meds required to be manually discontinued on eMeds. Patient transferred home with HITH. Letter from the HITH team to ensure GP is aware of admission to HITH. The patient is to be transferred and not discharged to the inpatient HITH ward. And once the HITH care is complete and the patient is discharged from HITH, a discharge summary will be sent to the GP. Referral to HITH and what to chart. Continue to refer to HITH as per usual processes. Phone call to HITH AMO. For patients accepted under HITH, the HITH medical team will provide advice on what medications need to be charted on the medication administration record as HITH meds. Complete the III referral form. Paper medication chart is no longer required. HITH medications must be charted in eMeds prior to referral. Encounters. It is important that patients are transferred and not discharged into the HITH or HITH COPILOT ward in the same way that they would be transferred to any other inpatient unit. This is generally the responsibility of nursing or admin staff. Transferring the patient will allow medications to continue on eMeds. If a patient is inadvertently discharged, medications will no longer appear on the MAR and will need to be recharted. Community nursing will be unable to administer any medications until recharting has occurred. Prescribing and supply of HITH medications. Your role as the discharging team is an important one. When your patient is ready to be transferred into HITH or HITH COPILOT care, continue to review their medications needed for discharge. For patients transferred to HITH from ED, chart HITH medications directly on eMeds and manually generate any prescriptions required. For patients transferred to HITH from an inpatient ward, use the discharge reconciliation function to reconcile medications and generate prescriptions prior to transfer to HITH. The discharge reconciliation function continues to be accessed via medication list or orders. Via the reconciliation drop-down, we can access the discharge reconciliation. The play icon indicates continue taking at home. The stop icon indicates do not continue taking at home. And the pill icon allows us to create a script, if required, for supply of any new or changed medications or anything that the patient may be running low on for supply from inpatient pharmacy. The script will need to continue being printed in eMeds, signed off and given to facility pharmacy for supply prior to the patient going home. You can also use the Add button to generate any other scripts that the patient may require for discharge. Power plans. HITH infusers are now available via a power plan. Power plans continue to be ordered via the Orders tab. There is a special power plan folder that groups all the power plans turned on for that facility. This can range across the LHD. You can also search for the power plan by typing HITH in or the medication you would like to prescribe. Select the most appropriate plan for your patient and click Done. The first phase of the power plan allows you to create an order to be sent to pharmacy for supply. Here you're able to choose the dose that the patient requires. Complete any information that may be required, such as special instructions. Find the printer that the computer is mapped to for the script. Click on Initiate Now, and then your script will print out for signing to be sent to inpatient pharmacy for supply to be ordered. You'll notice that the first phase of the power plan is completed and the second phase is planned. We have not ordered the infuser on the MAR. To be able to do that, we go back to the orders page and refresh. Find the power plan that you would like to initiate now. Find the MAR order phase. Generally, this gets done when the patient's about to go home and infusers are available. Select the dose that the patient should be on. Review the first dose date and time. Enter in the most appropriate information. Continue to complete an indication as that is mandatory. Continue to obtain AMS approval numbers and document that within the medication order. If required, you're also able to pop in a duration. Once you're happy with the order and completed all items, click on Initiate Now, Orders for Signature, and then Sign Off. You may get an alert pop up for the anti-infective start date and time. This is because the antibiotic is starting more than an hour from now. If you are happy with that, continue to accept and click OK. Refresh your page, and in the orders page, we're now able to see Phase 2 is now initiated. Within the MAR, once we refresh, we're now also able to see the cefazolin infuser with the start date and time of tomorrow. Non-HITH medications. Any non-HITH medications that the patient will be self-managing at home need to be manually discontinued as advised by the HITH AMO. You can discontinue these medications that are non-HITH via the medication list or via orders, utilising our right-click and cancel discontinue function. This will cease the medication on EMR. Transfer of care. Continue to update the discharge summary with an overview of care provided during the in-hospital stay. The HITH team will provide a letter to the GP to advise them that the patient is at home under Hospital in the Home service. The GP will not receive a copy of the discharge summary until the patient is discharged from the HITH COPILOT service. Points to remember. Patients must be transferred and not discharged from ED and inpatient wards to HITH. Antibiotic infusers are prescribed using a new two-phase power plan. From inpatient wards, a discharge reconciliation must be completed prior to a patient being transferred home on HITH. From ED and inpatient wards, manually discontinue non-HITH medications immediately prior to transfer home. The HITH team will advise which medications are part of the HITH treatment plan and that need to be charted on the MAR. Thank you for watching the workflow walkthrough on eMeds in primary and community health HITH and COPILOT services.